Hi, I'm Dr. Annelle Primm. I'm Deputy Medical Director at the American Psychiatric Association, and I'm also Director of the Office of Minority and National Affairs, which houses the Minority Fellowship Program, which is funded by SAMHSA. This is a very important program that has been in existence since 1975, and since that time, we have supported and nurtured 433 fellows who have gone on to lead very productive lives of leadership and giving back to the community. This program has been focused on helping to educate and enrich the professional growth of psychiatrists from minority and underrepresented groups who are in training. And the purpose is to develop a greater cadre of psychiatrists who are focused on providing culturally competent, evidence-based psychiatric care to communities of color, diverse and underserved populations. I'm very fortunate to be here today with Dr. Aeva Doomes, who is a former fellow of the Minority Fellowship Program, and she's going to be telling us about some of her experiences with the MFP. Dr. Doomes, thank you for joining me. I'd love it if you'd tell me a little bit about your experiences with the Minority Fellowship Program.
Okay. I was a fellow in the Minority Fellowship Program between 2008 and 2010 during my residency in the University of Maryland in adult psychiatry. And while I was participating in the program, I was fortunate enough to be able to develop a postpartum depression screening scale that was used in the OBGYN residency clinics that was specifically targeting picking up signs and symptoms of postpartum depression in women of color and African American women. My participation in the Minority Fellowship Program gave me the ability to work on the research project and have dedicated hours to be able to see the project from beginning to end and see it being used in the clinics. And it also gave me the time to travel to different meetings and meet experts in the field of psychiatry.
Tell me a little bit about what you're doing now and how the Minority Fellowship Program prepared you for your current work.
Well, currently I'm seeing children in a psychiatric facility in Washington, D.C. The majority of the children who are hospitalized, about 95%, are on Medicaid and come from very impoverished backgrounds. And my time in the Minority Fellowship Program really helped me to meet other experts in what we call community psychiatry or psychiatry in inner city environments so that I can understand the different kind of limitations on outpatient care and how that translates into some extended inpatient stays or limitations on the types of therapies that can be provided in some communities due to financial constraints. I was very, very lucky to meet experts in the field of child psychiatry in the APA who were able to serve as mentors to help me to understand my role as a child psychiatrist in this sort of environment and how the limitations that are placed on the families carry over into the treatment of the children.
Okay, well, Dr. Doomes, thank you so much for taking the time out to talk with me. You are a shining example of how the Minority Fellowship Program really develops an important product for our nation to increase services to underserved communities. Thank you so much.